Thanks for watching this video, but understand that this is just one small part of a comprehensive video that I did about managing yourself on testosterone replacement therapy. So if you do want to see the full video, I'll put a link at the end of this video and one down in the description. Quick disclaimer, this is not medical advice. This should not be used to treat or diagnose medical conditions. This is for educational and entertainment purposes only. Now let's get into this video. Now let's get into part 2, estrogenic side effects when on testosterone replacement therapy. Estrogen is something to be managed on testosterone replacement therapy. Not always lowered, it's to be managed. So what we like to do with figuring out if somebody needs their estrogen kind of toyed with is we look first and foremost for estrogenic side effects. So do you have nipple sensitivity? That's usually a telltale sign that we gotta corroborate this with some blood work. Secondly, are you having emotional swings? You're on a therapeutic dose of testosterone, you're not blasting a bunch of underground gear, but you're still feeling high at one moment, sad at the next, angry at the next. Sometimes that correlates with high estradiol levels. And then lastly, it could be erectile dysfunction or loss of libido, sometimes an inability to climax. That doesn't always have to do with estradiol. It especially doesn't always have to do with high estradiol. And we're gonna have a section on that later, but it can have something to do with estradiol, and that's usually a low-hanging fruit for us to check. So if you are dealing with estrogenic side effects, we corroborate that with blood work. Now, this is not a hard and fast rule, but it is a good general rule if you're dealing with estrogenic side effects. Is your estradiol higher than 1/20th, for some guys 1/25th of their testosterone? So let's say you're somebody that is dealing with estrogenic side effects, your testosterone is 1000 and your estradiol is above 50, maybe that's an indication that we treat. So how do we treat high estrogen, or how do we manage estrogens in the male patient on TRT? First and foremost, the easiest way to manage, in our case, what we typically talk about as estradiol, is to manage testosterone, because testosterone goes through a process called aromatase. It aromatases into estradiol. So if you can manage the testosterone, you downstream manage the estradiol. So the first thing we look at is the dosing frequency. So guys that come to us from their urologist or they're doing black market stuff, sometimes they'll do an injection once a week or once every 2 weeks, even worse. And what that does is you have a big spike of testosterone and then a trough, spike, trough, spike, trough. And this spike, again, your testosterone is super high. That aromatase enzyme is also gonna make your estradiol high. So if you're dealing with estrogenic side effects, why don't we just smooth out those peaks and valleys? And the easiest way to do that is just increasing injection frequency. So instead of just doing it once a week or once every 2 weeks, we'll typically do twice weekly injections, and that goes a long way to managing the peaks and valleys of testosterone and therefore the peaks and valleys of estradiol. Secondly, we like to do a subcutaneous where possible, or a shallow intramuscular injection. Reason being is because there's less blood flow in fat. So you'll also have less of a peak and a trough because the testosterone, it takes a little bit longer for it to be fully released. So subcutaneous injections instead of deep intramuscular injections will also smooth out those peaks and valleys, and again, smooth out the peaks and valleys of estradiol. And then lastly, managing the actual dose of testosterone. Some guys, their testosterone will be super high and they should feel great, and let's say it's still 1/20th to 1/25th the estradiol is to their testosterone, but they're still having estrogenic side effects. We can lower the testosterone a little bit, and sometimes that makes the estrogenic side effects go away. Not always, and I shouldn't even say often, but it will move the needle for some guys. So let's say your testosterone is looking good, you're at a good level, you're doing twice weekly injections, you're doing a shorter needle, but you're still having estrogenic side effects. These are some supplements that I can't sit here and tell you I believe in. I can't, but some guys swear by it. And guys that I respect a lot in this industry, they swear by it. So one of them is DIM, the other one is calcium deglucarate. So DIM basically works by changing estrogen metabolism. So it takes some of the more aggressive estrogens, to make it very simple, and turns them into less aggressive estrogens. So those estrogens will have less of an effect on your body. Calcium deglucarate acts by basically helping you excrete more estrogen when you poop. So your body is not able to absorb as much and redeploy it in the bloodstream. Now, there is good mammal studies to show that these could work to help with estrogenic side effects, or at least estrogen in general. Do I see it really move the needle for guys? I don't. I'll be honest, I really don't. You might have a different experience. If you do, let me know down in the comments down below. I'd be happy to hear your experience. I want to be proven wrong, because if we can use a supplement instead of a drug, I'm all for it. But for some guys that they've tried all of that, calcium deglucarate, the DIM, they're still having estrogenic side effects, we will use an AI. So that's an aromatase inhibitor. So remember at the beginning of this section, I said testosterone converts via aromatase to estradiol. So aromatase, basically, in general, converts androgens into estrogens. Now, the two that we're talking about is testosterone and estradiol, but that's true across the board. So when I say estrogens, then there are multiple different estrogens in the male body. But for our case, we typically focus on testosterone and estradiol. An aromatase inhibitor basically prevents that enzyme from converting testosterone into estradiol. Now, these drugs really do work. They work extremely well. So we start with a very low dose, because believe it or not, high estradiol has side effects, low estradiol also has side effects. So estradiol, low estradiol, very low estradiol can result in things like joint pain, erectile dysfunction, and also a low mood, almost a disturbance or a depression. Now, estradiol is to be managed. We use a very low dose of anastrozole to manage guys that are aromatizing and having estrogenic side effects. This is something to be managed as well. As your body composition changes, you may notice you don't need that AI anymore. If you're getting more muscular, you're losing body fat, everything's improving, it's important to keep tabs on your blood work, because what worked for you a year ago might not be what you need right now, especially if you're living a healthy lifestyle. So to wrap up our estrogen section, make sure that you're managing testosterone first. You can try supplements like DIM or calcium deglucarate. And then lastly, you can use an aromatase inhibitor to lower your estradiol in relation to your testosterone.